Okay, so in this article titled Acute Myeloid Leukemia with Translocation 821 or the inversion 16 in elderly patients treated with conventional chemotherapy, this was a collaborative study of the French CBF AML group, and this article was published in 2009. Now, acute myeloid leukemia with the translocation between chromosome 8 and 21 or the inversion in the chromosome 16 involves rearrangement of the core binding factors, CBF genes, which are CBFA and CBFB. These genetic alterations will disrupt the transcription factors and the transcription of these genes, which is crucial for myeloid cell differentiation. Now, patients with CBF-AML typically have favorable prognosis when treated with intensive therapies, including high-dose cytarabine. And the aim of their study was to conduct a retrospective study to evaluate the characteristics and the outcome of AML with translocation 821 and inversion 16 in elderly people as they were taking their chemotherapy and their medications. So an overview, they first assess the incidence and the prognosis, and the incidence of this disease decreased with age, representing less than 5% of AML cases in individuals over 6 years old. And elderly patients with CBF AML generally achieve higher complete remission rates, means that they no longer have cancer at all, and longer survival compared to those with other AML types. However, their outcomes are often less favorable than those of younger patients, with a 5-year overall survival rate of 48% in the general population compared to 22% for patients who are over 65. And this difference in percentages is because there are challenges specific in elderly patients, which is mainly leads them to be resistant to chemotherapy. And those factors may include the patient's overall health and functional status. In the case of CBF-AML, these host-related factors may prevent the use of high dose of the medication cytarabine, further complicating the treatment. Now, for the patient selector, the patient selection criteria, they selected a cohort of patients who are 147 elderly patients who received at least one course of anthracycline plus cytarabine-based induction chemotherapy, and they analyzed these patients. First off, they studied actually the cytogenesis in these patients, and they divided them into two groups, the ones which have the translocation between 8 and 21, and the one who had the inversion or the translocation in chromosome 16. And they found out that the patients who had the translocation 821 exhibited a higher frequency of additional abnormalities compared to those with inversion 16, and these may include trisomy 22, which is associated with inversion 16, was only found in 10 patients, and it was the only sole additional abnormality in 63% of the cases. The deletion in the long arm of chromosome number 9 was associated with translocation 821 and occurred alongside other abnormalities too. The loss of the sex chromosome was frequently observed in the patients with the translocation 821, including the deletion of X chromosome in women and deletion of Y in men. And they observed also complex karyotypes were identified in 23 patients, including 5 with monosomy 7, those who also had the translocation 821. And there were also other abnormalities such as monosomy and deletion chromosome 11 abnormalities and trisomy 21. And after they assessed the cytogenesis, they wanted to assess the survival of patients after the treatment, and they divided it into two parts. First, they assessed the overall survival rate, and they also assessed the leukemia-free survival and the rate. And the difference between the two is that it's when they say overall survival means that they consider the death from any cause, and it provides a broad measure of survival, while the leukemia-free survival focuses only on the duration a patient remains free from leukemia after achieving remission. So it provides more an insight into disease-specific outcomes of the treatment. OS provides more of a broad measure of survival. So starting off with the OS survival rate, and after a median follow-up of 48 months, 60 patients were alive, with 55 in continuous first complete remission, called CR, which is all the signs and all the tests indicated that they are free of AML. A total of 87 patients died. 78% due to relapse, means that they got the disease again. 17% is from induction death, means that they have a certain toxicity because of the treatment itself. 5% died from other causes, including metastatic melanoma, breast cancer, congestive heart failure, and infection. Relapse occurred in 57% of the patients, with a median time of 10 months from achieving complete remission. And the median overall survival was 24 months. The univariate analysis identified the high white blood cell count, poor performance status, and deletion of the long arm of chromosome number 9 as factors which negatively affected OS rate. However, trisomy 22 was actually associated with a favorable outcome, means that there was a longer OS rate. And the cytogenic groups, the T821 and the inversion 16 and age, did not impact the OS rate in this case. And this was also confirmed by multivariate analysis with WBC count and the performance status and the deletion of chromosome, long arm of chromosome number 9, were actually negatively affecting the OS rate. For the other rate, which is the leukemia-free survival, the median survival was 18 months, which is less than that of the OS rate. And the univariate analysis revealed that the factors like the performance status, critical illness during induction, high WBC count, and deletion of long arm of chromosome number 9 were significantly linked to short LFS, similar to the results obtained in the OS. However, trisomy 22, by contrast, and the intensive consolidation therapy were associated with a longer LFS. And there was a trend toward a longer LFS in patients who were receiving intermediate to high doses of citrabine compared to those who were receiving a maintenance therapy or lower concentrations, especially in those who had the translocation 821. However, this effect was not observed in the inversion 16, and it was actually in the measurement of the LFS that they were able to kind of have a distinct difference between the translocation, the two translocations, based on the concentration of the citrabine. Now here I was actually kind of analyzing and summarizing the other results when they mainly compared them to younger patients and compared elderly patients to younger patients. So a notable finding was that a reverse ratio of CBF subtypes with a higher median white blood cell count in a T821 subgroup and lower frequency of extramedullary disease compared to younger patients. And the frequency of additional chromosomal abnormalities was similar to that in younger patients. It was observed in 48% of elderly patients and was more common in translocation 821 compared to the inversion 60. Now, also, the study found a negative impact of deletion 9 on the overall survival rate and LFS, consistent with the findings of younger patients, but it was not universally reported. Trisomy 22, as said, had a positive impact on both OS and LFS in patients with inversion 16, although this was not confirmed by multivariate analysis. And the rare occurrence of complex karyotypes, the additional, for example, monosomy or trisomy, did not significantly affect the outcomes when it comes to the survival rates. And recent studies also emphasize, as reported by the authors, that the importance of other biological factors, and this was kind of future directions by the author, that CKIT mutations, which are associated with poor prognosis in younger CBF AML patients. So the impact of these mutations in elderly patients has not been studied due to the lack of available samples, since the percentage of CBF AML in patients over 60 is actually 3% to 7% only. So here they were trying to have future directions for other authors and scientists to study this CKIT mutations and its effect. And the importance of this study also that it identified disease-related parameters, the WBC count, the performance status, the deletions as significant predictors for relapse and mortality. And they are crucial when it comes to evaluation the comorbidities and the functional status and the overall health of the patients, because it could significantly impact how the chemotherapy will work. Also, despite achieving a high complete remission rate of 88% comparable to younger patients, the study observed that 10% mortality rate during induction with significant morbidity. A substantial portion of patients required intensive care, and those who survived often had poor long-term outcomes, suggesting that initial chemotherapy toxicity should be minimized. And the potential replacement of anthracyclines with gemtuzumab, also jamiesin, is proposed as a promising approach because, as said, there was 10% death due to the toxicity of the chemotherapy itself. It was not related to the health of these patients, and this should be, of course, minimized. For the future directions, also the study raises concerns about the optimal post-remission therapy for the elderly patients. While intensive treatments are often avoided due to their toxicity, the study found that there was a better LFS rate when it comes with intensive post-remission therapy, particularly in patients with the translocation A21. The number of high-dose cytarabine courses significantly impacts outcomes in younger patients, but the study's low number of elderly patients receiving multiple cycles limits the conclusion. So they basically are, they did find that higher concentrations improve the LFS rate, but it also causes toxicity in elderly patients. So this is a question that should be answered. So that's why the results suggest that intensive salvage therapy should be considered for elderly patients, aim to just remove the disease when they have a relapse for the disease, especially those with inversion 16. And a first CR duration of over 12 months, rather than just having a palliative care. Means, instead of just treating, what the patients are feeling, and if trying to make them feel good, they should try to have the medications and the therapy that is going to remove the disease by itself. And that was it. Thank you.